All right, well, hello everyone. I am Emily, I'm with the Meridian Library District, and thank you for joining us today for this very special panel on such an important topic. Today, we are speaking with some of our community leaders on getting back to business and answering your questions about the new COVID-19 vaccines. We are thrilled to be partnering with the Ada Community Libraries and the Boise Public Library to bring this event to you. So we have solicited questions in advance from the public so that we can keep this moving along quickly and cover the most important information for the widest audience. We will be recording today's panel and sharing it with our many partners so that anyone who wants to view it can do so. And now we are going to keep introductions very brief because we know there's a lot to cover on this topic. If you would please give a hand wave, I'm going to introduce our moderators today first. We have Sean Evans, CEO of the Meridian Chamber of Commerce, and and Lindsay Moser, Public Relations Director for the Boise Chamber of Commerce. Thank you both for being here today. And really quickly, just for our panelists, we have Natalie Bodine, Central District Public Health Preparedness Program Manager. We have Dr. Patrice Burgess, Executive Medical Director at St. Alphonsus and Chair of the Governor's Vaccine Advisory Committee. Dr. Lori McGeorge, I believe we are still waiting on Dr. McGeorge, but hopefully she's able to join us. She's with St. Luke's Health System, Primary and Specialty Care Service Line. She's the Medical Director. We have Dr. John Kaiser, Chief Medical Officer for Saltzer Health, and Dr. Ann Weiss, Primary Health Clinical Director. And thank you all so much for taking the time to be here with us today. And with that, I'm going to pass the mic off to our moderators, Sean and Lindsay. Thank you.
Thanks, Emily. Thanks, everyone, for joining us for this great panel discussion today. Myself and Sean Evans will be the moderators. We're going to kind of go back and forth asking different questions to each of our panelists. We have a lot of questions to cover on the vaccine. So before we begin, we're just going to kind of get an overview of each of our panelists, how each of their institutions has been doing on distributing the vaccine, and then kind of how the vaccine is distributed once it hits the state of Idaho to someone's, a patient's arm. So we're going to go ahead and start with Dr. Burgess, who is the head of the Governor's Vaccine Distribution Committee. So Dr. Burgess, what has that committee kind of been like, and what's it been like working with each of the local health districts as well?
Thank you very much. So the Coronavirus Vaccine Advisory Committee is the committee that I chair. We work very closely with all the health districts. And just to kind of give an overview, the vaccine is distributed by the federal government, and the formula that they use is a little bit mysterious. We've discovered that Idaho is about 47th among states in the country as far as how much vaccine that we're receiving. And that we think is based on discussions on our population under the age of 18. But there's a lot of discussion around census numbers and whether that's really accurate. So when you saw early on that we were not looking very good in our vaccine distribution, it's because they were counting per capita how many vaccines were given. So all of those people were being counted, even though we were not receiving vaccine based on our actual per capita numbers. So you should see new numbers now that are measuring how well we're doing based on how much we're receiving and getting it into people's arms. And we're doing actually quite well. We're anywhere in the top 10 in the country. So I just want to reassure people about that. So it comes from the federal government. And then our Vaccine Advisory Committee helps determine priority groups. And we really do a couple of things. We model after the CDC and the Advisory Committee on Immunization Practices. And we look at what they've recommended. And for the most part, we try to stay with those recommendations. But sometimes we make some adjustments for Idaho based on the statistics that we see as far as where we see the most illness and also our infrastructure. So it's a real tough balancing act. We want, if we had enough vaccine, we wouldn't even need a committee. We would just vaccinate everybody. But we really try to balance who's going to be most likely to get sick and be in the hospital, both for their own protection, but also to preserve our hospital capacity. And then also the infrastructure as far as making sure we have people to take care of patients and we have our basic needs met. And then the 7 health districts get the vaccine from there. And I will turn over to Natalie to talk about how the health districts do distribution from there.
That's a perfect segue into my next question for Natalie, who's with Central District Health. Tell us a little bit of how it goes when the vaccine arrives in Idaho to when it's in a patient's arm. What does that process look like for you guys?
Yeah, thank you. So just like Dr. Burgess says, Central District Health does follow the Idaho vaccine prioritization and distribution timeline that is approved and gone through by CVAC and then later approved by the governor. And our main focus is really to partner and support our healthcare providers across our jurisdiction, which includes Ada, Valley, Elmore, and Boise County, about over 500,000 people in total. So we're supporting our healthcare providers across our jurisdiction that have that current capability to receive, store, and administer COVID vaccines, who have also been approved by the Idaho Immunization Program. So as of yesterday, we have a total of 126 provider locations who are approved to administer COVID vaccines. So that is really great capacity across our jurisdiction. So Central District Health receives a number weekly from the state immunization program on how many doses of vaccine that are available to allocate to enrolled providers across our jurisdiction. We then have an internal vaccine allocation work group that meets to determine how many doses will be allocated to the different enrolled providers. So even though we have 126 enrolled provider locations, with the limited number of doses that we are getting for our jurisdiction, we are only able to allocate to around 23 of those providers at this time. So again, as more vaccine becomes available, we will expand into that network of providers who are eager and ready to go. After our allocation work group meets, we then send our weekly allocation plan up to the state immunization program, who then places the order for vaccine. And in District 4, that vaccine is direct shipped to those enrolled providers. It does not make a stop at Central District Health. We put our order in, and that vaccine gets directly to those enrolled providers. So we are currently averaging around 7,000 doses per week for our whole jurisdiction. So when you think about over 500,000 people across our 4 counties, 7,000 doses, 8,000 doses a week doesn't go too far. So we are doing the best that we can to get that out as quickly as possible. So thank you.
Thanks, Natalie. Now we'll just kind of
Dr.
go
Burgess,
around.
a follow-up question. Sorry, Lindsay, I have a follow-up question for Dr. Burgess. Natalie's just shared with us what Central District Health District is getting as far as doses on a weekly basis. And you said the Fed has a formula. What are we averaging in the state of Idaho as far as number of doses for the state currently, if Central District Health is getting 7,000?
You know, we'd have to look at the website. It changes all the time, but I think we're somewhere, and Natalie helped me, 30,000 per week for the entire state, hoping to move up into the 40, 50,000 range in the next couple of weeks.
Is that evenly split between the 2 currently approved vaccines, or is it heavier or one dose or one vaccine over another?
Fairly even, but it does vary. And then we had significant weather issues when we had our snow. So we had some delays on what we were expecting to get this last week and a half.
Okay.
Great. So I'll just kind of go to each of you now, just talking specifically about your organization and how the distribution has been going for you guys. So Dr. Weiss, we'll start with you guys at Primary Health. I think you might be on mute, Dr. Weiss.
Sorry about that. Yes, what we've tried to do is to manage the high demand and the large volume of calls we've been getting. And our population health department has kind of given a point system to our patients based on their age and their chronic medical conditions. So we've been moving through that list on an invitation basis, opening up the scheduling opportunities to these groups of patients at a time to kind of control the volume and the interest. But despite the challenging situation and the unknown supply every week of what and how much vaccine we're going to get, I think Primary Health has done a really good job with the rollout. We've given 26,000 vaccines so far, have another 14,000 scheduled. And we do vaccines every day and then host larger clinics on the weekends. Last weekend, we were able to get out 5,200. But I think overall, it seems to be working fairly well. We've opened it up to age 65, any patient, not just primary health. And then we continue to vaccinate healthcare workers, first responders, teachers, and such.
Great. Dr. Kaiser, give us a little insight about Saltzer Health. You're also on mute, Dr. Kaiser.
It's the way we always start with the talking. So we use a similar approach at Saltzer Health. We started with one location to provide vaccines 7 days a week at our 24/7 urgent care. As the supply increased, we've opened up additional facilities. We now have 5 facilities, 2 in what would be Southwest District Health and the remainder in Central District Health area. We book them 3 weeks out at a time. We are appointments only. We started with the 80-year-old groups of our patients and invited them. And now we've opened it up to 65. We allow anyone to make appointments as they become available. As you might expect, the appointments are taken really rapidly. So it's pretty much like one of those games where it opens up and you try and get on and get an appointment. I think it's gone really smooth. We automatically book the second scheduled vaccination booster at the time of getting the first one. We send out reminders, and so far it's gone very well, and hope to continue it and hope to increase as we get additional supplies.
Perfect.
Dr. Kaiser, follow up on that. Dr. Weiss had mentioned that they are accepting at times non-patients of primary health. Is Saltzer doing that as well, or is it limited to current patients of Saltzer Health system?
No, anyone can access our website and book an appointment as long as they meet the prioritization category.
Okay, thank you.
Perfect. And our last panelist that we have, Dr. McGeorge, do you want to give us a little insight on St. Luke's?
Yes, good afternoon. Thank you. I was just looking at our dashboard, and we've given 56,000 vaccines so far. One of the things that's been very challenging for us is as a health system, and I think St. Al's experiences this a little bit probably, but we're across 3 different health districts. And so we have different supply coming in, and we also have challenges, as Dr. Burgess mentioned, with the weather last week. But other challenges is as there are more distribution centers for the vaccine, our type of vaccine may shift on us what we get. And as you all know, we need the first dose, the primer, and then the booster have to match and be the same. So we have some feathering going on too. And our largest daily 7-day-a-week large volume clinic in Boise is gradually feathering or shifting out of Moderna and shifting in Kaiser. And we tend to be doing a lot more Kaiser, I think now, just because that is more readily available to us. The other thing I would say is, as a community-based health system, really, I think the community a lot of the community has reached out to us for the vaccine, and our supply, like everyone else's, has been quite limited. The day that the vaccine, it was a Monday that it opened to age 65 and up in the state, our servers crashed, our phones crashed, even for basic healthcare and calls and things, because there were so many people trying to access the MyChart, which is our medical record, as well as access our phones to try to get vaccine. When we do release vaccine, and we might release inventory for about 1,500 doses at once, they're usually gone in about 10 or 15 minutes. And that really, I think, speaks to the demand that's out there. We are working on trying to figure out a system so people can at least even anticipate if we have doses available. But again, even when we turn it on, they fill that quickly.
And just a quick follow-up too. So when you know that you are going to have 1,500 doses available, do you put that on immediately on the website? Is it Tuesdays at 10 a.m.? What's kind of your guys' process, or is it more spontaneous than that?
So our approach has been that we do not want to, we are trying everything we possibly can to cancel appointments. But, you know, when you do that, what happens is we really only schedule as we get vaccine available. So people might, you know, we've had this situation where people looking at our website and saying, oh my gosh, there's no vaccine available until July. Well, it's not there actually is no vaccine until July that's in our hands, but, you know, we really, really want confirmation, solid confirmation that it will be in our hands before we open up spots. And so our vaccine team meets twice a week, but virtually meets sometimes multiple times a day as things are moving so quickly. I mean, our goal is to just, if we get our hands on vaccine, open up more spots. And I think, you know, the other thing is just for the public, I mean, just how incredibly challenging, I think, for all of our organizations this is operationally, because just opening up slots, well, you have to have people to work the slots, right? And then the other thing is you need, you know, what's a little unique about the COVID vaccine operationally compared with other vaccines is you really do need to wait 15 minutes after this vaccine. And in some people it's 30. And while you're waiting, you need physical distance because of the pandemic. So that too adds some additional challenges.
Excellent. Lindsay, if we can maybe move on to our questions, I think we'll touch on some of those just so that we have plenty of time for the questions that came from the public. The first section that we're going to do is the safety and effectiveness of the vaccine. We're going to try and limit the time so that we can make sure we can get to all the different categories. Lindsay, you want to start with the first question?
Yep. Thanks, Sean. Dr. Weiss, this question is for you. Can you just give a little bit of background about the vaccine in general, how it's developed and approved for use, and what is an emergency or FDA emergency use authorization?
Sure. You know, this emergency use has been in the news a lot, and I understand people might not know what that is. I didn't until this COVID pandemic, but it has been used before in public health emergencies. And that's the key, is that Health and Human Services declares a public emergency like they did with COVID last year. And then that opens up this expedited pathway that the FDA can get certain things approved, whether it's experimental medications, therapies, tests, or vaccines. And so with this expedited process, it's not necessarily an FDA approval, which typically can take years of data collection. So you won't see that these are FDA approved, but it is authorized for emergency use that we need in a pandemic situation. And so the vaccines go through all the same trials that regular vaccines do. It's just quicker and sometimes in parallel with each other. And the FDA has to decide, once a company comes to them with their proposal, are the known and potential benefits of this treatment, this vaccine, do they outweigh the risks? And in a pandemic, you know, there's just such a need for this vaccination that these Pfizer and Moderna have been allowed through. But both of them have been tested on over 30,000 study participants and have very good efficacy. And so people often ask, were steps skipped? Is this safe? And the answer is no, steps were not skipped. It was just accelerated. And these vaccines are very safe.
And I think funding too that came in for COVID-19 and getting that vaccine obviously helps a lot as well.
Yeah, the funding through the government with this Operation Warp Speed just gave this huge support and wave of money and resources for the drug companies to get these vaccines out. And so it seemed to work pretty well.
Dr. McGeorge, we've received a couple of questions about why people should get this vaccine, given the recovery rate and maybe the not severe impact that it has on some people. Can you briefly review what we currently know about the COVID transmission recovery rates and long-term effects, and why a vaccine is important for this particular disease?
Sure. So I think, many of us in healthcare have really had a personal, obsessive, relentless effort to avoid getting it ourselves. And the reason why is we know what can happen even in people who aren't hitting the news because they're hospitalized or they die from COVID. So, I think whether you call it long COVID or long haulers COVID, it's called, I've seen it both ways. I think the CDC is more adopting long COVID as the nomenclature. But, that is a syndrome of persistent severe fatigue, headaches, brain fog that goes on beyond the disease. And, one of the things that we know, so a couple of things is, one is 3/4 of people hospitalized with COVID, following up 6 months later, 3/4 of them have some ongoing symptom from COVID. That is profoundly, to me, profoundly significant. So it's not just you get better, you go home, life goes on. 3/4 of them are having symptoms 6 months later. So now if you look at patients, so even patients who did not require oxygen during the hospitalization have reduced lung function 6 months later. And then if we go to the population who doesn't even end up in the hospital, somewhere between 35 and 55% of them have symptoms 2 to 4 months later. And so that is really significant effect on quality of life. And I think, as time goes on, we're going to see more and more of that and understand more about it. But, the risk, whether you're hospitalized or not, the risk to long-term symptoms is big and is real.
Okay. Thank you.
Dr. Weiss, I'll go back to you. If you have a heart condition, will the COVID vaccine affect you in a different way, or what are your recommendations?
We haven't identified any conditions that should not get the vaccine. Kind of a different way to think about it is, what is your risk of severe illness or death when you have a chronic illness like diabetes, heart disease, COPD, cancer? And the data shows that if you have one of those conditions, your risk is much higher of dying from COVID. And so that's why these vaccines are so important. So people with chronic medical conditions should get the vaccine.
Dr. Kaiser, this is a question from the public. Alex submitted this question. How effective are the vaccines against serious illness? And what do we know about the effectiveness of the vaccine against the wide variety of variants that we're hearing about now?
So the vaccine, the original data that was presented showed a very high efficacy and in preventing severe illness. So it's one of the highest that we've had for vaccines, 80 to 94%, which is quite amazing. I do always want to point out in that does mean that it doesn't prevent all illness. So you can get a illness from COVID-19 even with the vaccine. The probability is low, and the severity of the disease seems to be significantly reduced with that. But there is still that possibility, and that leads to some of the other considerations that we talk about why you should continue to use the protective measures to prevent spread of the disease. So overall, it's a very, very effective disease prevention vaccine. And I think we'll continue to learn more data as we have more time and greater populations. But we have vaccinated a significant amount of patients, and the results are continuing to confirm our original projections on how good the vaccine really is.
Okay, and maybe this question the follow-up can come out to anyone. What about the new variants? There's a lot of discussion of this. The Moderna and the Pfizer vaccines were created for one specific type of the variant of the disease. How is the medical community and the research community approaching it with these different variants? Dr. McGeorge?
Sure.
Dr. Burgess, anyway?
Yeah, I can. So clearly, so first of all, variants are normal. All viruses mutate. So first thing to understand. Second thing about the variants and the vaccines are that absolutely this is being watched very closely, but even the vaccines that are out there continue to show excellent performance in preventing all disease from COVID, any disease, which is important, but not 100% of the time, but very effectively. But they continue to be very effective in preventing severe disease, meaning mostly hospitalization and death. So those are being monitored. You know, the other thing is, I think nobody knows this, but we don't know. Fast forward, will we have an annual COVID booster? Maybe. And I think that's just how we have to think about it. But again, having had a COVID vaccine still is going to provide you some immunity, and probably very good immunity to these new strains relative to not having had the vaccine.
If I could add on to that real quick, the other thing that they're looking at is the vaccine actually giving you better protection than natural infection, because natural infection, your immunity is going to be to whichever strain you were infected with, whereas the vaccine's more likely it's the protein on the virus to protect you against the variants than if you just had the disease itself.
Okay, thank you.
I'll take the next question, Dr. Kaiser. This has come up probably as one of the biggest topics, and as someone who is 20 weeks pregnant currently, the effect and your guys' recommendations for pregnant women. And even I think throughout the trimesters too, as I've talked to several friends who are pregnant as well, you know, if you were to get COVID in your third trimester, is that more dangerous than the first? And your thoughts on the vaccine in general on pregnant women.
Yeah, so I'll give a little background first to try and set the stage for the recommendations in reference to pregnancy. First of all the data that we have indicates that symptomatic patients who are pregnant who get infected with COVID-19 are at increased risk for more severe illness than their non-pregnant peers. So that's the first thing to know. So are you in a risk category? And as a matter of fact, they added, you know, there was some debate in the beginning, and then pregnancy was added to the high risk category. So I think that's the first thing to know. The next is, just like in the general population, if you have comorbid conditions, that increases your risk further than compared to peers who don't have those comorbid conditions. The other part that I think is important to know is about the vaccine and the concern about being pregnant and the effect on your genetics. And so because it's an mRNA vaccine, it does not get into the nucleus of the cell. So it cannot change your genetic makeup. It is not a live virus. And when we look at what we usually use for criteria of what's safe in pregnancy, viruses that are not live, vaccines that do not use live virus are generally considered safe in pregnancy and recommended. And if you remember a few years ago, we went through the influenza, and the first recommendation was that it shouldn't be given in the first trimester for concerns. That was later reversed. So the thinking on this vaccine is that it is safe for all trimesters. It is recommended to have discussions with your obstetrician, your physician, about what are the risks. The part of it that is concerning always is, did we test pregnant patients? No, there was some patients that were pregnant in the studies, but it was not an arm of any of the studies. So of course that leads you to not know with as good a certainty as if you had those patients in the studies. But all the evidence are patients who were pregnant inadvertently or became pregnant shortly after have not shown any adverse effects to it. So I think that, and then the next level of evidence, what other evidence do we have about the safety? There are animal studies that have been done. They're limited because of the time that we've had, but have shown no adverse effects from animal studies. So I think those are the things we have in our armament that says we should strongly consider it. The next point is, I think there's a couple points to it. If you got the first vaccine, the first shot, the initial shot, and now you become pregnant, should you get the booster? And the recommendation is yes, you should complete that course. The next is you decide that you would like to have the vaccine. Then if you fit the prioritization group, you should get that vaccination. All of our information, we believe it is safe and it prevents the illness that you can have more severe outcomes just because of your pregnancy. No genetic risk known to it. The last is, if you make that decision not to get vaccinated, we should all support your decision in making that, because there is some uncertainty to it. So I think that's kind of the the broad spectrum of how we think about it. But generally, my recommendations to patients who are in the category of prioritization is to get the vaccination.
That makes sense. And just one more follow-up to that as well, because I've read that there have been hopefully a couple more ongoing studies of the antibodies potentially being passed on to your baby if you have received the vaccine. Can you speak to that at all?
Yeah, it's a process that occurs on many of these vaccinations, and there is some transferred immunity that occurs through the process of you creating the antibodies against that. So we believe it will be protective. Do we know with certainty? No, but if we look at the mechanism of how it works in other vaccination programs, other viral illnesses, the answer is yes. And so it is reasonable to assume that will be the case here also.
Great, thanks, Dr. Kaiser.
Lindsay, let's move on to the next category of questions, and it's on vaccine rollout. You touched on some things earlier about the process in the state, but the public has some questions and some concerns. Lindsay, you want to start with the question?
Absolutely. Natalie, we'll kind of kick this one back over to you. There's a question that we received from an older couple that had been unable to get the vaccine as of February 14th. So just about 10 days ago. We have been trying unsuccessfully for over 2 weeks to make appointments. What do you suggest that we do?
Yeah, thank you, Lindsay. This is certainly a concern and a frustration that we are hearing as well. And I'm sure our vaccinating providers are hearing as well on a regular basis. And with the limited supply of vaccine that's coming into our jurisdiction and into our state weekly, we see that may continue for a little while longer. And we want nothing more than to see our most vulnerable community members get vaccinated as quickly as possible. So we have a number of things that we are doing at Central District Health, as other vaccinating providers are doing as well, to help assist those in the public kind of navigate different providers and different schedules. So Central District Health does have a call center that is open and available to the public and operating Monday through Friday from 8:30 a.m. to 4:30 p.m. That number is 208-321-2222. So we have recorded updates on vaccine and vaccine availability, and all of our call center operators are also able to answer a host of vaccine questions and then work with those people in our community to help them walk through the process and guide them to different vaccinating providers. So we do have a list of current vaccinating providers that we are allocating vaccine to on our webpage. And that will include information and links for each of those providers on how to access and schedule. And that list is updated regularly. So as we get more vaccine, we are trying to bring on more providers to open up that capacity for everybody. One tip I would recommend, given the timing of when we hear about how many doses we're going to be able to allocate, is I would start reaching out, checking those provider web pages and those links, maybe starting Friday afternoons and Saturdays, that is when most schedules may be opened up, not guaranteed. But it seems like once, as you've heard other providers say, once those schedules are opened up, they fill pretty quickly. So, as you look at the number of doses we're getting per week, and then, even in our 65 plus age group, we have about 80,000 people that fall within that group. So when you're getting about 7,000 doses a week, you can see how that's going to take a little bit of time. So we do understand that frustration. We do have more vaccines coming into the state via some other federal programs. They're on top of what we're getting, so that's great news. And some of that is coming in through the retail pharmacy program. So pharmacies like Walmart, Red Rock Pharmacy are receiving some additional doses that they're able to open up some appointments to. And then Idaho Department of Health and Welfare has also announced that they will be pushing out a new registry tool for the public, which will be another avenue to connect people to vaccinating providers. So look for that sometime next week. They're hoping to launch that here soon. So again, the demand continues to outweigh the supply, but we are receiving indications that we will be getting more and more vaccine on a weekly basis. It's just trickling in, but we hope that that faucet gets turned on here sooner than later. So stay patient. There will be vaccine for everybody, but we do understand the frustration. And please call us if you need assistance.
Just to follow up on that, this is a question that got a lot of interest from the public, and we're hearing it here from our members as well, that the process, while it may be improving, is inefficient and very frustrating for the public, because everyone has maybe a little different process, whether you're going through the MyChart access, or you're calling a phone number, different things. This question, I may put this to Dr. Burgess from the state level. Is there plans to maybe improve this from the state level, since every district's handling it differently, and maybe utilize some of the federal funds to create a one-stop location for people to find all of the options available in their area?
Yeah, thank you. There is a lot of effort with that, but we do have 7 autonomous health districts. And then within each of those districts, we have providers that, vaccine providers, they each have their own system. So it is complex. But another resource I would add to the ones that Natalie mentioned would be the website coronavirus.idaho.gov. And that's where we have a lot of information on where the vaccine's being allocated. You can see how each of the providers are doing in getting the vaccine out. But as we work on additional tools to have a one-stop shop, that's where you'll see that show up. But there are some technical issues to work through to have that to work. And I agree with everything that she said. The pharmacies are starting to get their own separate supplies, so that's a good place to keep looking as well.
Awesome. Well, Dr. McGeorge, this question is for you. This was from a viewer that said, I contracted and recovered from COVID last summer. Is there an argument for me not to schedule my vaccination the first opportunity in order to allow others who have immunity to access their vaccinations before me?
Yes, so there are a couple of scenarios there. So one is, if you just recovered from COVID, you shouldn't be going out anyway within your 10 days or 20 days if you were hospitalized. So for sure, very recent people with COVID should not be getting vaccinated for that reason. If you've had COVID within the last 90 days, a couple of things is if you got monoclonal antibodies like bamlanivimab infusion, or if you had like mixed plasma given in the hospital called convalescent plasma, you actually can't get the vaccine for 90 days. Beyond that, if you had COVID, I think it's reasonable if you've had COVID within the last 90 days, it's probably reasonable to wait, but the CDC does not have guidance saying that you should wait. And in fact, again, keeping in mind that the state is prioritizing based on either your risk of getting really sick from COVID or your risk of getting COVID or your essentialness to the community. So, balancing that, I think it's reasonable if in the last 90 days you've had COVID to wait until those 90 days. But certainly if you had it last summer, absolutely, I would go ahead and get the vaccine if you can get it and you fit in the state tiers.
Great.
All right, I'm going to go off script a little bit because some things have come in the news recently. And this question may be a little bit for Dr. Burgess, but anybody else can chime in as well. The recent news about the Johnson & Johnson COVID vaccine being a single dose, how much of an impact on the rollout will this new vaccine make since it's being a single dose and having 3 varieties of the vaccine available to us? Dr. Burgess, has the state heard anything yet on the rollout of that?
No, so that's being looked at tomorrow, actually, by the FDA. And if it does receive emergency use authorization, well, then the Advisory Committee on Immunization Practices is planning to meet Sunday and Monday to review and make any recommendations. And then our Idaho committee will look at those recommendations and determine what we need to do for Idaho. It's a fascinating situation. The single dose is very appealing. It does have slightly less efficacy than the Moderna and Pfizer, but pretty good efficacy against severe disease and ICU admissions and death, which is really kind of our ultimate goal. So the other thing is the logistics are so much easier. One dose and it doesn't have to have the ultra cold refrigeration. So that opens up some opportunities to things that are currently challenging, as has been mentioned. One thing we forgot to mention was the multi-dose vials for Pfizer and Moderna create even additional challenges because sometimes they have 5 doses, sometimes 7, sometimes 10, sometimes 12. So all of the scheduling becomes more challenging when you have a fragile vaccine that once you pop that vial, you've got 6 hours to use it. So the Johnson & Johnson just creates a lot more flexibility because it's not as fragile and it has the 1 dose. But we have yet to look at it because it has yet to be approved, and we'll have to look at the recommendations that come out of the national entity and then adapt them for what makes sense for Idaho.
Okay, excellent. Moving on to the next section, just so we make sure we cover everything, and what to expect when it's your turn to be vaccinated. Some people seem to be getting ill after receiving the vaccine. My wife has received both of her doses as she works in the healthcare field. And she did have a little bit of a reaction, not allergic reaction, but just a fatigue feeling and things. Can you explain why that happens? This question is for Dr. McGeorge. Sorry.
Yeah. So I'm going to change the language there a little bit. They're not getting ill, they're feeling ill.
Sure,
and that's a very big distinction because the vaccine, what the vaccine is doing is triggering your immune response. And it is that immune response that you're feeling. And so, you know, there is a very, very rare likelihood of getting ill, and that would be what I would call anaphylaxis. And we know that's about 4 in a million. So hardly, you know, if you do the math in Idaho, that's not a lot, right? So the feeling ill is common. It's more common in people that are younger. It's more common at the booster. I personally would describe it as influenza light, you know, with the muscle ache, the joint aching, maybe tired, light, you know, slight fever or feverish, just kind of want to lie around, watch a lot of Netflix, that kind of thing. So it's normal and to be expected. And then also, of course, the immune reaction, we see a lot of that in the arm, just more sore, really no different from what people, if they've had the shingles vaccine, some of the pneumococcal vaccines, the pneumonia vaccines have been known to do that too. So it's really normal, and it is your immune system reacting to the vaccine.
Can I add to that too, that, you know, those are all normal reactions, but you shouldn't be getting respiratory symptoms like cough and sore throat and that kind of thing. That would be something different. And that's not a common reaction to the vaccine at all.
Kind of a follow-up to that. Are there any immune builders or boosters like zinc and vitamin C recommended before and during the shot process?
No.
Simple answer.
No, and you know, I'll just add to that a little bit. I think there's been some confusion on this, but generally the recommendation is to don't pre-treat before your vaccine with things like Benadryl or Tylenol or ibuprofen. But if you are having, you know, like the low-grade fever or something after, then sure, go ahead and use over-the-counter medication that's appropriate.
Dr. McGeorge, we'll kind of stay on you for this question as well. Can I still get COVID if I get the vaccine? And do I still need to wear a mask after you've had the vaccine?
So I'm sorry to say yes and yes. So a couple of things. Yes, you can get COVID after you get the vaccine. Back to kind of thinking about the data, remember the Moderna and the Pfizer are 95% effective. So that means 5% of people can get COVID. None, though, seem to get severe infection. Johnson & Johnson, it's a little lower, maybe around 75%. Therefore, 25%, yes, could get COVID, but again, mild. But a couple of other little caveats to think about. So one thing is, so I personally, as a physician, got vaccinated and got Pfizer. I still could have asymptomatic carrier of COVID. So if I'm sitting in a coffee shop or a restaurant, which I don't do right now, but if I were to do that and be sitting around a bunch of people and someone had COVID and was spewing it at me, you know, yelling and laughing in the bar, for example, that virus I could be a carrier for that virus. And then when I go home to my family, could take it home and spread it to my family. We think that's less with the vaccine, but that possibly is still the case. And that is why masking. And then one other thing I want to bring up on masking, you know, I think all of the physicians on this call will agree. We saw very, very little influenza and almost no influenza, almost no respiratory syncytial virus, RSV. People die every year from those, babies or old people or all in between, right? And we didn't see it. And so, I mean, I think we've learned a lot of things about masks this year and how effective they can be.
So to follow up on that, just to clarify, the vaccine keeps you from getting seriously ill, or is designed to keep you from getting seriously ill, but it's still transmissible. You could still get the virus after you get the vaccine, and you could still transmit it. You're just not going to get the serious illness with the vaccine. It's there to prevent you from having that serious illness, correct?
So yes. And you know, again, it's probably less likely you're going to get the vaccine as a carrier if you were vaccinated, but it is still a possibility. And also the studies weren't really positioned to look at that as much. So I think we'll learn more over that, but that is one of the main reasons why even if you've been vaccinated, you should still be wearing a mask. Okay.
For those that have had COVID, you know, they get tested for antibodies and things like that. After you're vaccinated, will you test positive for COVID antibodies in a blood test, or is that a little bit different? This question is for anyone.
I can take that if you'd like. You know, it depends on the antibody test. So the antibody test for different parts of the virus. Remember, we're not giving you a live whole virus. We're giving you a fake spike protein. So it really depends if the antibody test is looking for antibodies to spike protein, maybe. Right now, really the antibody tests, and you know, in my opinion, are really still best for public health purposes, but not really making individual decisions for patients. There are some small areas that might be, but no, just grabbing an antibody test is not going to tell you whether or not you should get a vaccine or whether or not the vaccine was effective. It's going to depend on the test.
Okay, thank you. On to our next section, and this has to do directly with our chambers of commerce as well. What does this have to do with business? One of the things that we're hearing from a lot of businesses is, how do you incentivize your employees or the people to get this? And I want to ask specifically how you as healthcare employers are handling the reluctance that you may see from your employees of getting the vaccine. How are you incentivizing them to get the vaccine when they're eligible to get it? Let's start with Dr. Weiss.
You know, it's at this point, the vaccine isn't required for any businesses. And so it's not, you know, but what we have done is just a big education campaign to our staff to clear up misconceptions. There's a lot of misinformation out there about COVID and the vaccines. And so we hit them with a lot of education and promote it as a leadership team. We've given our strong recommendation that all our staff get it, and then have laid out why. But I think the real science is a way to incentivize people to get the vaccine, to keep themselves healthy and their community and their business, and to keep people at work.
Okay, thank you, Dr. Weiss. Dr. McGeorge, St. Luke's being one of the largest employers in our area, what are you doing to incentivize the employees to take the vaccine?
So I would say again, it's the same. It's relentless education. We have had 3 all-employee webinars starting in December, and probably like once every 3 weeks or so with the rollout. We continue to invest heavily in educating our physicians through CMEs so that they too, frontline physicians, feel comfortable and confident speaking with their staff about the vaccine and answering questions. And then really continue to work a very robust FAQ, whether it's public facing FAQs or internal FAQs, to help, when we hear questions or concerns, we are doing that. And then last, I would say, is we just recently surveyed all of our employees to find out, anonymously, but who did not get the vaccine and what were the barriers or the reasons for not getting the vaccine.
Okay, thank you. Dr. Kaiser, Saltzer Health.
Yeah, very similar. The only other thing as a part of the education is we try to emphasize the point that as healthcare delivery system, that it's important for you to be here for your patients. And if we don't, if we continue to have our own employees who had to be quarantined, that puts a roadblock in our ability to provide care to our patients. So we try to use that as also an incentive for them to want to be vaccinated and to participate in the process. But it's mostly education.
Okay. And Dr. Burgess, my wife works for St. Alphonsus, so I know a little bit how she was incentivized to get it. But what are you doing at St. Alphonsus?
Very similar. It's really an internal PR campaign. We have posters. We have, much like what you've heard, we have webinars. We have all of those things. But I will say, the first shipment we got was December 14th, was the first day we were giving vaccine. And it really did set the Christmas spirit. We've had lots of enthusiasm about the vaccine. And I think seeing people that are doing well, that have continued to tell their coworkers is the best advertisement we can have. And finally, having something positive that we can do during a time when we've had very little happy news during this pandemic.
Mm-hmm.
I'm going to shift just a little bit. Sean and I obviously represent the business community, and we try to have our business's best interest in mind on how we can get back to normal commerce. So this question is geared towards Natalie, maybe even Dr. Burgess as well. When can the public feel confident that enough people have been vaccinated and we can see business return to somewhat normal practices? Natalie, let's start with you.
That's a really hard question, and I don't know if I have a great answer for that. I think we are learning more and more on a daily basis, and as more of our communities across the state become vaccinated, we'll begin to see that shift. So I will turn that over to some of the medical professionals if they have anything to add.
Yeah, so I will add that, the governor's original phases of opening and reopening were based on transmission, rates of transmission in the community, and also the occupancy of our hospitals, particularly our ICUs. We're actually doing pretty good with the ICUs right now, which is exciting. None of us are quite ready to let our guard down, of course, but we are happy to see that. But we still see a pretty significant transmission in the community right now. Luckily, not severe disease, but still disease. And so those numbers would be what I would say we would look at when that transmission rate gets down below 100 per 100,000, for example. We could start looking at maybe loosening things up a little bit, but that's the scientific way to make a decision about reopening the economy.
I would, my perspective is that I think we can get to a win-win where, again, anything we can do that costs nothing from an economic perspective. And so example of that is masking. That costs nothing and yet helps the health systems reduce the burden of COVID in the health system, saves lives, and helps get businesses opened more quickly because we can reduce community spread. So to me, things like that are no-brainers that we as a community can do, and whether they're mandated or not is probably more political. But if we care about, which we do, of course, I know we all do, getting our kids back in school, or care about our neighbor who owns a small business and their business is really suffering, just doing those basic public health recommendations are going to help us all get where we want to be.
All right. We've got just a couple minutes left before the end of the hour, but I did have one other question, and this is, we don't have an HR specialist on here or an attorney, so I'm asking you this mainly from your organization's point of view. How should employers handle sick days for employees that are actually experiencing side effects? Have you done anything with your organization to address that specifically with their employees to encourage them to get the vaccine? Dr. McGeorge.
So nothing specific to that, but I would say this is, I think any barrier that employers can do or reduce to encourage or allow their employees to get vaccinated is in their best interest. So if you can, and we are seeing it, definitely seeing people have like a bad day after the booster, especially maybe like a day where if you're super tough, you kind of slog through and come into work, but a lot of people won't. And I think that is well worth it to an employer, given the cost of having someone miss a lot of work or potentially quarantine, after exposure or worse things happening. I think it's well worth that missed one day of work.
Okay, thank you. Anyone else want to chime in on that?
Well, I would say we've also upfront tried to say, let's be smart about not vaccinating the entire emergency department on the same day, because we know there might be a chance that some of those people might not feel good the next day. So we've been staggering, groups of people that work together so that we minimize that risk. And then also, if you're somebody that works so many shifts and then you have, so many days off, maybe you get vaccinated right before that stretch that you have a few days off. I agree with everything Dr. McGeorge said. Most people can work the next day, but there are a few that just feel under the weather or maybe, would feel better laying on the couch that day. But a lot of that can be planned ahead of time.
I don't see anyone else wanting to chime in. That does conclude our list of questions for our panelists, and we appreciate you all taking the time to participate and share with us today. On behalf of the Boise Chamber of Commerce and the Meridian Chamber of Commerce, we'd like to thank the Meridian Library District, the Boise Public Library, and the Ada County Community Libraries for making this program available to the public. With that, we'll turn it back over to Emily to wrap up our event today. Thank you, Emily.
Well, thank you so much, everyone. We really just wanted to say, thank you to all of our panelists, our moderators, for taking your time out of your valuable days to come and speak to our viewers. I know we'll have a lot of people who watched live, a lot of people who will watch this in the future as well. So thank you so much. And we do have some resources as a final slide here if you have more questions that you'd like to have answered. So thank you again for your time, and everyone, I hope you all have a great Thursday.
Thank you.